Paul Bloom on the phone here. We'll get him teed up and see if he can expound a little bit more for us as we take a look at this. Is the still picture that Jen Coutu took about 30-40 minutes ago of that clinic, and then we also have some live video on the ground as well.
And again, this shooting happening, we think, a little before 11:30 or so, and we have very limited information, but Paul Bloom is ready now. Paul, tell us what you know, and take it away. Tell us what you have.
Yeah, good morning, guys. I'm in the car. I want to be perfectly frank with our viewers and you guys. I'm not quite at the scene. Obviously, you see our video. We have crews there. I'm en route. Been making phone calls this morning with sources, and a trusted law enforcement source describes this scene as a disaster. I don't know, again, what you're exactly seeing right now from our cameras. I presume we're a decent distance back, but describing this very much an active scene there. Gunfire this morning, multiple bombs is what was reported to me by a source with direct information of law enforcement on the ground there. Multiple victims, numbering up towards double digits, at least preliminarily, that they're talking about. Several described as critical condition. So this is a major critical incident. My understanding is agencies in Minneapolis, Hennepin County, perhaps even further away, sending what we call backup to that area to help with the scene. This is an overwhelming scene for the police in Buffalo and Wright County. I just got off the phone with a spokesperson for Allina Health. We believe it is an Allina Health clinic where is the center, the heart of what, again, has been described as a disaster. He is referring all questions, comments, developments at this point to the Buffalo Police Department and the Wright County Sheriff's Office, so really awaiting more information from those folks in terms of what they're dealing with. And at this point, they might not have a full understanding of the situation. Again, reporting multiple bombs, gunfire, victims down in the range of double digits. So a lot of concern about what is going on there. I will, of course, be there all afternoon. I'll continue to make some phone calls and send it back to you guys. But again, the thing that made my hair stand up is when that law enforcement source described this scene as a disaster up there.
Paul, we want to let you get back to those calls, but I do want to ask you if you can hear me. This is Amy. Do your law enforcement sources at all know if this situation spreads beyond the clinic? When you talk about the possibility of multiple bombs, is there some concern in other parts of the community, or does it seem like it's really concentrated here at this clinic?
Yeah, I would hate to answer that one directly, Amy. Just in terms, I just do not have enough information to confirm, placement of bombs and directions. Obviously, I'm very curious to see how far this, so-called perimeter is set up. I'm still a few minutes away from getting my own eyeballs on the situation, being able to assess it. But clearly, it's a decent footprint, just based on what our crews are telling us who have arrived there. And you're just your thoughts, your prayers with everybody up in the Buffalo community. I mean, this is a healthcare clinic. It's just hard to fathom what took place this morning, and the motivation behind what we think has unfolded here this morning.
And Paul, that leads me to my next question. We've been reporting the suspect is in custody. Are you hearing that from your sources as well? And do we know anything about this individual?
My sourcing at this point is not something I have confirmed, so I trust our reporting throughout our newsroom. Obviously, we have a complete team digging into what's going on, both on location, on the phones. So if that's information being reported, I have no reason to question that. Obviously, I'm learning with you as making calls and driving to the scene, but it's obviously an active scene. We'll wait for sort of that first official word from law enforcement on the ground there. Again, a line pointing me to the Buffalo Police Department, the Wright County Sheriff's Office. They will be the lead agencies here, but my sourcing saying they will have plenty of backup, plenty of joint assistance, bomb squads, detective help from the metro area, all descending now on this medical campus, if you will, this healthcare clinic in Buffalo in the far northwest reaches of the metro.
All right, Paul Bloom, we appreciate that information.